I'm Michael Betel, president and founder of the Fatty Liver Alliance. We raise awareness about the risk, causes, and complications of fatty liver disease and help those already diagnosed with MASLD and MASH by advocating for access to approved treatments and care. Today, our very special guest is Dr. Manal Abdelmalek, who's a hepatologist and professor of medicine at the Mayo Clinic in Rochester, Minnesota. She's a world-respected expert on MASLD and MASH. As part of our Liver Insights series, focused on you, the patient, Dr. Abdelmalek will share the latest on MASLD and MASH diet and lifestyle adjustments that you may need to make and helping to guide you on possible nutritional and lifestyle changes to manage and mitigate your liver disease progression. Dr. Abdelmalek, finding out that you have fatty liver disease and what it could lead to is super scary for patients and their families. With regard to food and nutrition, what should patients know and where do they start?
Yeah, Michael, first of all, thank you for the opportunity to be here with you today. Taking care of patients has been a passion of mine, and taking care of patients with metabolic dysfunction and fatty liver disease certainly is an area of where I've spent much of my time for over 20 years. And there's nothing more important, and I commend you on your initiatives and your passion than helping our patients take control of what they can do to help their health, help their liver disease. And I find that there's nothing more empowering than knowledge. So, metabolic dysfunction. This disease has recently been renamed from not alcohol related fatty liver disease to metabolic dysfunction associated steatotic, meaning fatty liver disease. And this is a condition which stems from really a lot of environmental factors as well. It is associated with weight gain. It's associated with obesity and diabetes. And there's nothing more foundational in being able to care for this disease than lifestyle modification and dietary changes. So let me just share with you a few
Sure.
slides, and I use pictures often to talk to my patients, even in clinic. So sometimes a picture is worth 1,000 words. Um, but just to point out, not every patient is the same. Some patients can lose weight very easily. Other patients put it on very easily. And so, in my opinion, every patient is uniquely different, and every patient should talk to their doctors about what can work for them and what they can do to achieve diet goals for their diet and goals for weight loss. And it's particularly important depending on where patients live and what they have access to. So, in order to tackle this condition, weight loss, diet, and exercise are the very first and most important thing we can do. And how we get there doesn't seem to really matter. It's not one size fits all, it's uniquely tailored to every individual. And then we can drill down beyond that into various aspects of our diet. For example, not only what we eat, but what we drink, whether we smoke or not, whether we're consuming too many sweetened beverages like soda or pop or Coca-Cola, whatever part of the country you come from and what you call it. And whether we can do some things that might appear to be healthy for us, such as increasing our coffee consumption. And doctors are going to talk to our patients about lifestyle first and foremost. It is the foundation of how we approach metabolic dysfunction and associated steatotic liver disease, and even its progressive form, what we call MASH, metabolic dysfunction associated steatohepatitis, when there's actually injury in the liver from excess fat. But beyond that, then we really need to drill down. And I know others are going to talk about this: managing diabetes, managing cholesterol, managing blood pressure, ensuring that we don't have sleep apnea. So I'm going to just highlight what I think is important. We can't put this all on our patients. Some things they can control and other things they can't. But we can't control our genes. We can't control our ethnicity. And uh, uh, metabolic liver disease certainly can run in families. It equally affects men and women. It increases as we get older, but there are certain things we can't modify. I wish I could modify my age, but I can't modify my age. But there are other things that are so, so important that can be controlled. And so it's really important for to empower our patients to say, these things we can modify. Look, we can modify weight. We can modify how much alcohol we drink, how much we smoke. We can modify getting a good night's sleep and sleeping well. We can modify how much fat and sugar we put into our bodies. We can control our blood pressure and our blood sugar by maybe increasing our activity and cutting some of our carbs or cutting excess salt or excess fat. So, knowing that there are aspects of liver health that are in our control, I think is very empowering and very important for our patients to understand. And so when I talk to my patients, I say, there are certain things here we need to pay attention to. And I discuss very much avoidance of food that are highly, highly enriched in high calories. High calorie diet, anything that comes basically out of a box, a bag, a bottle, a can, or a fast food window are foods that are processed, packaged with things that we need to avoid, which is excess sugar and something we call hydrogenated fats. So the fast food industry is typically foods that are very high in calories. Hamburgers can easily approach, 600 to 1,000 calories or more when bought through a fast food chain. And it's not just the calories. These type of foods have extra saturated fats, and they're high in cholesterol, and they're typically increase our red meat intake, and they're not high in what is good for us, which is fiber. So I really encourage avoidance of the fast food. And we live in a fast world, and it's not easy for everybody to do, and we get that. But thinking about how much we're actually taking in is important. And the other thing I talk to my patients about is all the bottles, the bags, the cans. Our great grandparents didn't eat this way. Um, Sweetened beverages are exceedingly high in carbohydrates and processed sugars, something we call high fructose corn syrup. And to just put this in perspective, if one were to eat an apple, that would be about 15 grams of fructose. But if you were to drink a soda, that could be as high as 50 grams, or maybe more, depending on the size of fructose. So you would almost have to eat 3 or 4 apples to get as much sugar as is in a sweetened beverage. And even the orange juice, how many oranges do we need to squeeze to get a large glass of orange juice? You'd almost need to squeeze 4 oranges. And so what you're doing is you're squeezing out all the sugar, but you're leaving behind all the fiber, which is really why I think nature made fruit sweet, is so we would eat what would otherwise taste like cardboard if it wasn't sweet. So eating the fruit and not drinking the fruit juice is really important. And I ask my patients to avoid things that come out of boxes and bags, what we call ultra processed foods. So the potato chips, the cereals that are boxed and extra sweetened, or even some of the things that are high in calories that would otherwise come out of boxes that are easy to cook, but also high in bad nutrients. Almost easier for us to bake and cook in a farm to table type manner. And so the industrialized world and the fast paced life certainly hasn't made things easy for us. I caution my patients, especially if they already have liver injury and steatohepatitis, and particularly if they have fibrosis, scarring in the liver, and especially if they have cirrhosis, we have to avoid alcohol because that can just fuel the fire of liver injury. So it's like having a burning fire and adding a little gasoline on it. You don't need to do that. So avoidance of alcohol use, particularly in those that have steatohepatitis and fibrosis on a biopsy, is important. But it does turn out that coffee consumption can be very good. As The data would suggest, at least 3 cups of coffee a day could be very healthy for the liver, could decrease the risk of cirrhosis, and may even decrease the risk of liver cancer. So we're learning a lot about these constituents in food. But ideally, if we can get to a diet, which likely our great grandparents ate before the industrialized era, is almost farm to table. Fresh fruits, fresh vegetables, grilled foods, never fried, and particularly foods that are high in omega-3 fatty acids like fish. So I encourage my patients to uh, gravitate towards white meat proteins like chicken or fish. Avoid a diet that is too high in red meat. Red meat maybe at least not even once a week. And if it is, it's just as small as the palm of your hand. Okay. And fresh fruits and vegetables, and the more colorful, the better. So if you had to pick from vegetables that are green, such as our spinach, our broccoli, our Brussels sprouts, are probably better for us because they have a lower sugar load, lower glycemic index, lower in carbohydrates than a white potato, for example. So, and fruits that are colorful, such as strawberries and blueberries, also have a lower glycemic index, lower sugar index than fruits that are white, like a banana or the core of an apple. So a rainbow array of fruits and vegetables, fresh and grilled meats, more farm to table is good for us. So that way we avoid the complex carbohydrates, the red meat, the extra refined sugars and fats, and we gravitate more towards what could be healthy for us. Coffee, have to drink a lot of tea to get the same amount of what we call polyphenols as in coffee. No more, especially if patients have maybe very mild or little liver disease, no more than a glass of wine a day for women, and as much for men. But be very cautious about the extra alcohol. Gravitating more towards fish, things that are rich in omega-3 fatty acids. And all these fresh fruits and vegetables have great antioxidants and things we call choline. So I'll stop sharing there, and I'm open to really asking questions. But that's what I tell all my patients in clinic.
No, that was really very helpful. One thing that came to mind is, as much as some people are aware already, even about the Mediterranean diet and eating healthy and eating fish, it's very expensive. It's much more expensive than eating at home, actually going out. You can get a whole meal for the family and it costs less. I mean, something that we all struggle with. So not only does it taste really good, but it's less expensive for the family. So, and there are also people, maybe they live remotely and it's difficult to get to it too. So I don't know if you can comment on those two
Yeah.
challenges for some people just to recognize
Now,
that.
this is a societal burden. There is no doubt that um, some patients can live in what we call food deserts, where the closest grocery store may be 10 miles down the road. And even then, not all grocery stores, especially in very remote places, have access to the best array of fresh fruits and vegetables. It is challenging, there is no doubt. But diet is a part of it. It if we do the best we can, understanding that if you have a choice between a sweet potato or white potato, gravitating towards the sweet potato might be better. If we have a choice between the wheat bread or the white, gravitating towards the wheat bread, we can make simple, small choices. And if you have a choice between the soda, which is 99 cents a gallon or maybe $1 a gallon, versus water, drink the water, that's free. So we could still make health economic
Right.
choices that are healthier for us. And also, even if we do increase the calories because we don't, you know, readily have access to the freshest fruits, we can offset that effect by increasing our activity and burning those calories. So, more walking instead of sitting behind computer screens or in front of iPhones. So, if we expend some of those extra calories that we eat, we can temporize the risk of obesity and diabetes and fatty liver disease.
Well, I think too, to note that even when you do go out to fast food, you can skip the bun, do a lettuce wrap. You don't have to put ketchup on it because that's all sugar, and you can have water or I know sugar-free drinks have other challenges. Maybe
Yeah,
they're not perfect as good as water, but it's still better than a sugar drink.
yeah,
Um, and it's interesting you mentioned about the about juices, and all of us were brought up, you know, and they still do it in restaurants. Would you like a fresh squeezed orange juice with your breakfast? And I'm like, no, don't do it
yeah.
because it's like all sugar.
Yeah, I would say, pass on the fresh squeezed orange juice
Yeah,
and ask for a cup of coffee or ask for a cup of water, maybe even ask for a cup of milk. And to your point, Michael, if one is in a position of having to eat on the run and going to that fast food window, instead of getting the fried chicken sandwich, why don't you get the
grilled.
grilled chicken and take off
Totally.
the bun? Instead of getting the French fries on the side, get the side salad or pass on the fries altogether. And so there are some restaurants that will have allowance for the apple slices or the side salad for the same cost as the French fries. But ultimately, while we are bearing the cost of a lower um, expense diet, we're gonna that cost is gonna come back in,
For,
medications
for
and
sure.
more frequent doctor visits
Yeah.
and treatments and potential need for transplants down the road. So, how much are we committed to investing in our health today as a plan to save for tomorrow?
So food for thought.
Yeah.
Thank you, Dr. Abdelmalek. Thank you so much. It was very helpful. I know tons of people are going to appreciate and learn from what you shared today. So thanks for joining us on this important segment today.
You're very welcome. And thank you for having me. It's just been an absolute pleasure.
Thank you.